47 million Americans are living without health care insurance. That means 1 out of 7 people. With no immediate action for change in our sites, grassroots efforts to provide much-needed health care to the uninsured have inspired free clinics across the country. Michigan, with 1.1 million uninsured citizens, has approximately 50 known free clinics. These clinics have been initiated by local clergy, healthcare providers, hospitals, or communities. With few paid positions possible, they are largely run by volunteers. No two clinics are alike in funding, scope, or support, but they all have a mission in common: the desire to at least make an effort to meet the growing needs of our families, our friends, and co-workers who are without health care, who have no insurance. The following people will tell you about their struggles to maintain their health, their dignity, and their lives during our Crisis in Healthcare 47/7.
7 years ago, I had a hysterectomy, and I didn't have insurance. I am still 7 years paying for the surgeon.
I don't qualify for Medicaid, and I don't have health care where I work, so...
I always had health insurance, and the store took it away from me, and it was like, where am I going to go? Because I don't have $300 to pay for these prescriptions.
Because of me having ulcerative colitis, I needed a colonoscopy, and I couldn't afford it.
I was having a lot of problems, swelling in my ankles, chest pains and whatnot. And I didn't have insurance, and I was basically trying to just wait it out and see if I would get better.
And the only way I could get any kind of medical attention was to go into the emergency room. And that made me feel pretty embarrassed. I don't like doing that.
I was miserable. I didn't have medication. I mean, over the course of those years, I had at one time had been on 13 prescriptions. And it was just, you know, I was a guinea pig for a lot of different medications because nothing they could find could control my asthma. And then all of a sudden, the medicine's taken away, and that's just as bad.
There aren't a lot of options in getting care for yourself. I work 7 days a week. And there's no benefits involved in it. The medicines that I take that are supplied by this clinic are more than what I make in a month.
You choose, okay, do I want a paycheck or do I want health coverage? And it is important, you know, you got to pay your rent, you got to pay your bills, and you have to choose if you want to be healthy or if you want to live.
We have too much income, which is just over $20,000. And it's like, I don't know how I know I'm going to have to get some kind of plan to pay for my medicine, but are we going to have any money to live after we pay for all these pills?
You know, then the bills pile up. You just pay them when you can.
I mean, when I came in here, I didn't know I was a diabetic. I didn't know I was hypertensive. I didn't know I had cholesterol that was absolutely higher than 10 different people. I didn't know I had all these things because I could not afford to go to the doctor, still cannot afford to go to a doctor.
Oh, big time bad, because like I said, I come here to the clinic and they give me my stuff for my diabetes, but I have a bad leg that's hurt me for 2 years. But I can't do nothing about it because I can't afford to go have surgery on this leg.
I make just enough money to not qualify for anything.
And my fear is what happens if I have to go in the hospital now? I mean, our family right now financially is barely making it. And, you know, it scares me.
I want to stay healthy. I want to be able to be around to see my great-great-grandchildren. But if I don't have the health care to get the medicines and advice and guidance I need to take care of myself, then I won't be here.
I worry about, the long run with things, if I get worse, because bills are piling up, and medical bills, and I just...
I wish there was some way to get some sort of health care without having to use the free clinic.
I mean, people are saying, oh, it's going to cost too much taxes, but you know what, when, like, how much the top 1% of American people, the rich people, make like 90% of the wealth in America, they can do extra program. I mean, they can pay extra taxes that might help fuel this universal health care. I'd have no problem donating $2 an hour of what I make to this program. I mean, if you gave that a choice.
I'm hoping that everyone can have equal health care, that people that are financially unable to afford health care, a lot of times end up dying or not getting equal or the right treatment as people that can afford it.
It's not a luxury. It's not something that we should have to compromise and feel bad about it, like we're getting this handout or that we want something for nothing, because we don't. That's not the case.
I don't know. There's just got to be something someplace. It's got to be on a docket somewhere. And it's got to be something that's taken care of soon, because sickness isn't going anywhere.
The healthcare crisis affects all of us. We cannot afford to be idle while costs, availability, and access to healthcare keep rising. You can join the effort to make a difference. Please act now.